Eating twice as much during pregnancy. Contrary to the belief that you need to eat for two, the reality is that you only need about 200 extra calories a day, assuming you start pregnancy at a normal weight. Overeating can lead to excessive weight gain and related complications. Focus on a nutrient-rich diet to meet your nutritional needs without overconsumption. A balanced diet ensures both you and your baby get essential nutrients without unnecessary calories. Sex during pregnancy hurts the baby. Sex during pregnancy is generally safe and does not harm the baby. The baby is protected by the amniotic sac and the uterus, which cushion it from any potential impact. Additionally, a mucus plug in the cervix helps prevent infections. Always consult with your healthcare provider if you have specific concerns or a high-risk pregnancy. Cocoa butter prevents stretch marks. There is no scientific evidence that cocoa butter or any topical treatment can prevent stretch marks. These marks are primarily caused by the rapid stretching of the skin and genetic factors. Using moisturizers can help keep the skin hydrated and possibly reduce itching, but they won't prevent stretch marks. Acceptance and care for your changing body are essential during pregnancy. It's okay to drink a glass of wine when you're pregnant. The recommendation is to avoid any alcohol during pregnancy. There is no known safe amount or time for alcohol consumption, as it can lead to developmental issues and birth defects known as fetal alcohol spectrum disorders, FASDs. Your belly reveals the baby's gender. The shape or size of a pregnant woman's belly does not indicate the gender of the baby. Factors such as the baby's position and the mother's body type influence belly appearance. Reliable methods for determining gender include ultrasound and genetic testing. You can give a cold to your developing baby. A baby cannot catch a cold from the mother during pregnancy. However, illnesses like the flu can affect both mother and baby, which is why flu vaccinations are recommended during pregnancy. What you eat during pregnancy influences the baby's palate. There is no evidence to support that a mother's diet during pregnancy influences the baby's future palate. A balanced diet is important for overall nutrition and the baby's health, but it won't dictate food preferences. Pregnant women shouldn't drink coffee. Moderate coffee consumption is generally safe during pregnancy. Excessive caffeine in the first trimester can increase the risk of miscarriage, but moderate intake after the first trimester is unlikely to harm the baby. Pregnant women shouldn't eat hot dogs. Hot dogs are safe if well cooked to avoid the risk of infection. Concerns about nitrates in hot dogs are minimal unless consumed in excessive amounts. Ensure they are cooked properly to prevent foodborne illnesses like listeriosis. Pregnant women shouldn't eat smoked salmon. Smoked salmon is generally safe during pregnancy if it is properly stored and prepared. Concerns about mercury and other toxins mainly apply to certain types of fish, not typically to smoked salmon. Pregnant women shouldn't pet cats. It is safe for pregnant women to pet cats. The risk lies in handling cat litter, which can expose women to toxoplasmosis. Wearing gloves while gardening and washing vegetables thoroughly can also help avoid this infection. Pregnant women shouldn't fly. Flying is generally safe during pregnancy. Pregnant women are at an increased risk for blood clots, so it is advised to stay hydrated, wear support stockings, and move around during long flights. Exercise during pregnancy can strangle the baby. Exercise is recommended during pregnancy and does not harm the baby. Regular physical activity can help with overall health and ease of labor unless there is a specific medical reason to avoid it. Dyeing your hair is harmful for the baby. There is no evidence that dyeing your hair during pregnancy is harmful to the baby. The chemicals in hair dye do not reach the baby in significant amounts to cause harm. There are simple tricks to overcome morning sickness. There are no simple tricks to eliminate morning sickness, but some strategies can help manage it, such as eating bland foods like crackers, avoiding strong smells, and staying hydrated with lemon-flavored drinks or ice. C-sections are always necessary for breech births. While C-sections are common for breech births, they are not always necessary. Some doctors may attempt to turn the baby before delivery, or deliver vaginally if it is safe to do so. Sitting all day causes breech babies. Sitting all day does not cause breech babies. The baby's position in the womb is determined by various factors, not the mother's activity levels. Pregnant women should sleep on their left side. While sleeping on the left side can improve blood flow to the placenta and reduce swelling, pregnant women should ultimately sleep in whatever position is most comfortable for them. This position is often recommended because it enhances circulation and decreases pressure on the liver. However, there is no significant harm in sleeping on the right side or in other positions. If lying flat on the back causes discomfort, tilting slightly to either side with the help of pillows can provide relief. Your hair and skin look better when you're pregnant. Pregnancy can affect hair and skin in various ways, with some women experiencing thicker, shinier hair due to hormonal changes. However, many women also face increased acne or skin pigmentation issues, such as melasma. The so-called pregnancy glow is not universal and can be accompanied by other less desirable skin conditions. Hormonal fluctuations during pregnancy impact each woman's body differently, leading to a range of effects on hair and skin health. Pregnant women become more flexible. Pregnancy hormones, particularly relaxin, loosen ligaments and joints in preparation for childbirth. This increased laxity can make some joints feel more flexible, but it does not enhance overall flexibility in the traditional sense. Instead, this looseness can increase the risk of joint instability and injury if not managed carefully. Pregnant women should be mindful of their body's limits and avoid overstretching during exercise. Eating spicy foods will induce labor. There is no scientific evidence to support the idea that eating spicy foods can induce labor. The onset of labor is a complex process influenced by the baby's readiness, hormonal changes, and physiological factors. While some women report anecdotal experiences of labor following a spicy meal, this is likely coincidental. Each pregnancy is unique, and labor will begin when the body and baby are ready, not due to specific foods consumed. Yoga can induce labor. Yoga does not induce labor, but it can offer several benefits to pregnant women. Practices such as yoga can aid in stress relief, improved flexibility, and better posture. These benefits can contribute to a more comfortable pregnancy and potentially easier delivery. However, there is no evidence that yoga directly triggers the onset of labor. This was according to our source, which was made 4 years ago. However, upon further research, yoga can actually induce labor. Certain yoga positions can assist the baby in moving into an ideal position for birth. When a mother's hips are supple and flexible, it can create more space for the baby's head to descend into the pelvis, which can lead to the softening and ripening of the cervix. What do you guys think? Let us know in the comments below. Natural births are better. There is no universal better way to give birth. Each birth experience is unique and personal. Natural births without pain medication can be empowering and positive for some women. However, medical interventions like epidurals and C-sections can be necessary and life-saving for others. The best birth plan is one that prioritizes the health and safety of both mother and baby. There are ways to predict your exact due date. The due date is an estimate, generally accurate within 2 weeks before or after the given date. Early ultrasounds can improve the precision of this estimate. However, the exact timing of labor is ultimately determined by the baby and various physiological factors. Babies arrive on their own schedules, and predicting the exact day is not possible. Yoga makes labor smoother. Yoga itself does not make labor smoother in a direct sense. However, the relaxation, mindfulness, and breathing techniques learned in yoga can help manage labor pain and reduce stress. These techniques can make the labor experience more manageable and less overwhelming. While yoga cannot guarantee a smoother labor, it can provide valuable tools for coping with the process. Now that we've covered some common pregnancy myths, let's shift gears and explore birth generations like Millennials, Generation X, and others. Understanding these generational dynamics can offer insights into societal trends and family histories. It's an interesting segue from debunking pregnancy myths to exploring broader generational contexts.